Gardner's syndrome. Gardner's syndrome is also called as familial multiple polyposis. So it is a hereditary condition, and the responsible gene for Gardner's syndrome is chromosome 5. So mainly it is a hereditary condition, and we have to remember that responsible gene, that is chromosome 5. Next, moving on to the clinical features. The age, it's most commonly occur in second decade of life and most commonly affect male. And the first clinical feature is colonic polyps. So these are most commonly found in the intestine. So this polyp has high degree of transformation into adenocarcinoma. And the second important clinical feature is osteoma, and it is most commonly in frontal bone, mandible, maxilla and sphenoidal bone. In mandible, this osteoma especially present on the mandibular angle. That's here the patient showing the osteoma present on the both side of the angle of the mandible and border of the mandibular region. So this produces some facial deformity. So this patient having Gardner's syndrome. So facial deformity due to the osteoma in the mandible and limitation of opening. In some cases of large osteoma of mandibular angle, opening of the patient's mouth may be reduced. And other features, some of the patient may have epidermoid cyst, thyroid carcinoma and desmoid tumor. These are the other features present on the Gardner syndrome patient. So may have epidermoid cyst, thyroid carcinoma and desmoid tumor. Next, moving on to radiological features. The first one is supernumerary teeth. It is very important. So there is presence of unerupted supernumerary teeth in the jaws and osteoma of the mandible. So these areas appear to be increased in radio density. Size varies from small to large. So in radiograph, it shows radio opacity. Osteoma of the mandible shows radio opacity. So this picture showing the patient having multiple osteoma on the mandibular angle region and mandibular bordal region. There is an extra radio density, radio opacity areas. So these are the osteoma. And next, moving on to diagnosis. We have to diagnose according to the clinical and radiological diagnosis. So supernumerary teeth with osteoma in the jaw and other parts of the body will favor the diagnosis of Gardner syndrome. So mainly there is supernumerary teeth and osteoma of the mandible or some other osteoma and intestinal polyposis. So here the management, first one is prophylactic colectomy. If there is high degree of transformation into malignancy, we have to done colectomy. And the removal of the jaw osteoma. Why we have to remove that osteoma? Because of cosmetic reason. Because it produces facial deformity. Otherwise, there is no need for surgery.